the context of infection control, what does the term aseptic technique refer to? Now, before we look at the choices, it could be helpful to refer back to any medical terminology or Latin language that you're aware of already to help with dissecting medical terminology. So let's break down the word aseptic. So if we have A and then septic. So septic, if you think of a patient that's in septic shock, going into sepsis, if you've ever heard terms like that, sepsis refers to like a really bad infection. So, infected. And then if you think of what the A beginning part might refer to in a medical term, have you ever heard of like asexual reproduction? That means that in like plants that are able to reproduce without doing so sexually. A, without. So, without septic. So, aseptic, not septic. So it's going to cause the opposite of septic or infection and therefore prevent infection or make sure that there is no infection. So let's keep that in mind when we look at the choices. What does the aseptic technique or the technique that involves making sure there's no infections refer to? So let's look at option A, a method to age medical equipment. No, that would be something different because this technique refers to preventing infectious disease, so we can eliminate option A. Option B says a technique to ensure an environment is free from disease-causing microorganisms. And when we say microorganisms, we know on the microscopic level, that's what leads to someone getting infected. And we're saying free from infection, no infections. That's how we defined the aseptic technique, which is what the question is asking for. So therefore, it's looking like option B is our correct answer. Let's take a look at the last two choices, though. Option C says a method to enhance the growth of microorganisms. So this sounds like the opposite of aseptic technique because it's enhancing the growth or increasing microorganisms. But really, aseptic is to prevent microorganisms. So we can eliminate option C. Option D says a technique used to color medical instruments, and no, the aseptic technique is not involved in that process, so we can eliminate that. And that leaves us with our correct choice of option B, a technique to ensure an environment is free from disease-causing microorganisms.